And as we just heard, Illinois' top doctor says she'd be the first in line to say the Omicron COVID tide has turned, but she can't yet. She says it is too early to tell. Amanda Vinicky joins us now with a deeper look at COVID cases and the surge's wider implications on healthcare. Amanda.
Yes, Brandis, we just heard Paris share those totals. COVID cases setting records, and so too are COVID hospitalizations, with the average these past 7 days exceeding 7,100.
We have never had this many COVID patients in the hospital at any point in the pandemic, not in spring of 2020, not in the winter of 2020. This is the absolute highest number, and not just by a couple. Our previous totals have been smashed.
Illinois Public Health Director Dr. Ngozi Ezike says those totals are leaving hospitals with a hard time treating other patients, threatening care for car accident victims, people who suffer a heart attack, burst appendix, or cancer complication. The state has asked, but not required, hospitals hold off on so-called elective procedures. Advocate Aurora Health isn't doing so across the board, though the director of infectious disease and prevention, Dr. Robert Citronberg, says with high numbers of patients and staff having COVID, various hospitals within the two-state system are doing so. He says elective, though, a bit of a misnomer.
We don't have enough beds or enough people to take care of those patients to do it safely. Now, this is important because elective procedures don't mean they don't need to be done. They do need to be done. They're just not emergencies. So it is concerning that we have to postpone elective procedures, as you're seeing all across the country.
Now, Wellington Thomas is an emergency room tech at Chicago's Loretto Hospital, and he says he sees firsthand that COVID is back with a vengeance.
When we had the first wave almost 2 years ago, it was bad. This time is probably the worst I've seen it, even in my department. We've had at one point almost every patient in our rooms was all COVID. We've had patients in the hallways, several beds in the hallways, several recliners in the hallways, with patients being there because we just don't have the room.
Thomas is also a leader with SEIU Healthcare Illinois, and the union is raising questions about whether the state should mandate a delay in these elective procedures. SIU's concerned, why are some hospitals continuing these profit-making procedures even as safety net hospitals like Loretto are particularly stressed? Thomas says it takes a physical and an emotional toll that has him considering quitting. Kim Smith is a patient care tech at Northwestern Medical, and she says that she also has to question whether she should place a priority on caring for the patient or for herself.
The truth is that I'm going to work and I don't know if my coworker beside me has COVID. And then I have to worry about taking it home to my 4-year-old grandson who's too young to get vaccinated, or me being too old to get sick, and I'm worried, and then, the fact is that I want to care for someone appropriately because they have been sick and they deserve to have the best care ever. They're already afraid, but how do I deal with my own personal fear?
SEIU Healthcare wants hospital employees to get a pay bump for working in these conditions and times, and not just for nurses and doctors, but universal hazard pay. That's across the board for all hospital employees. Now, the State Hospital Association had no initial comment on this. The governor, meanwhile, says Illinois is bringing in some 2,000 healthcare workers, including a federal team and then some healthcare employees that are on contract to help to boost staffing. Illinois also temporarily loosening licensing rules.
Out-of-state healthcare workers are now able to continue working in Illinois during the public health emergency with expanded permission, allowing them to care not just for COVID-19 patients, but for all patients in need. Second, doctors who received their medical training in another country can now provide assistance to licensed physicians here in Illinois.
Advocate Aurora's Dr. Citronberg says that he hopes as hospital employees who are having to quarantine from COVID return to the hospital, well, operations will soon, he hopes, be able to resume as normal. He also says that there is good therapeutic news as a new monoclonal antibody treatment comes on board.
This is important is because this product has activity against the Omicron variant. The prior monoclonal antibodies we used did not. So this antibody is very active against Omicron, and we've been successful. We've established infusion clinics around our system in both Illinois and Wisconsin to give outpatient infusion of sotrovimab. So we've been really ramped up to full speed this week on that.
The first oral antivirals approved by the FDA for COVID care have not yet arrived in Illinois hospitals, but the Illinois Department of Public Health has said that they're expected to arrive within the month. And I'm told it could even be within coming days. With that, Brenda, back to you.
Amanda, thank you.